I'm Steve Cole. I'm an obstetrician and maternal fetal medicine specialist working here at Epworth Freemasons for almost 20 years. I love looking after pregnant women, and my particular interest is looking after women with more complicated pregnancies and women who've had more difficult pregnancies in the past. So I get asked almost every day about travelling in pregnancy, and the answer varies, of course, depending on the type of travel that we're talking about and whereabouts you are in your pregnancy. So travelling within Australia on domestic airlines is usually not a problem in the early stages of pregnancy, and even later in pregnancy, most people with uncomplicated pregnancies can travel until quite late in their pregnancies, although generally you do need evidence from a doctor to say that you're fit to fly after you're about 28 weeks pregnant. One of the things women always have to consider, of course, is not that travel in itself is particularly problematic, but what happens while you're away if there's a problem. So if you do have some bleeding or you have some contractions and you think it might be early labour and you're in a different part of the country, you need to have a plan as to how you're going to deal with that. Long distance travel can be quite uncomfortable as you get further into your pregnancy, and it's always important to think about how you'll cope with all of that. Things, for instance, when you're flying, like using compression stockings to help with swelling, having maybe a supply of anti-nausea tablets in case you're feeling sick, and allowing yourself plenty of opportunities for rest is really important as well. So people often think about when should they not travel. When you have an uncomplicated pregnancy, domestic travel within Australia is usually fine up until about 34, 35 weeks. Travelling internationally depends a little bit on how far you're travelling, but generally around about 30 or 32 weeks is the upper limit. So if you are travelling away from home, it's important to take a few precautions. It would be advisable to carry a little card, at least with your blood group on it, and maybe even a copy of the notes that your doctor's made during your pregnancy, so that if you do need to see someone while you're away, you can give them some at least background information. It's also important to have emergency contact numbers, both for myself as your obstetrician, but also for family members who can respond if needs to while you're away. So international travel is a little bit more complicated because it depends, of course, where you're traveling as well as where you are in your pregnancy. You may have to think about things like particular vaccinations if you're travelling to certain countries, and it's always important to get expert advice about what vaccinations are safe to take in pregnancy. If you are travelling on long distance flights, you may also need to think about prevention of blood clots. So when you're pregnant, your chance of developing a blood clot is a lot higher, and when you're flying, that risk is magnified, particularly on international flights. So you need to talk to your doctor about whether you need some medication or other preventative strategies to minimise the risk of blood clots. So it's always important to speak to your doctor and to your obstetrician about your travel plans before you go. There may be things that are specific to you and your pregnancy, or specific to the places that you intend to travel to, that they need to consider and give you advice about.